There are 78 new cases of COVID-19 in New Zealand being reported today, and this is comprised of 73 new confirmed cases and 5 new probable cases, and that is as at 9:30 a.m. this morning. More details or information on these cases, including the probable cases, will be provided via our website shortly and updated as new details emerge. We will also be moving to provide information about the age and gender and geographical distribution of these cases, the latter as a map on either our website and or the COVID-19 website. There are 27 individuals that we can confirm have recovered from COVID-19 infection. Currently, there are 7 people in hospital and all are in a stable condition. 3 are in Wellington Regional Hospital, 2 in Nelson Hospital, and 1 each in Waikato and Northland Base Hospital. None are in intensive care. Our laboratories are continuing to work hard to process and report test results quickly. Yesterday, 2,417 tests were processed around the country, and so the total number of tests processed to date is 12,683. The average number of tests over the last 7 days is around 1,400. A reminder that anyone who has been tested is expected to remain in strict self-isolation, that is, isolating themselves even from those people in their own household until the test result is available. Public health staff and Ministry of Health staff are actively following up all close contacts of each case. In terms of our new cases today, the majority still have a link to overseas travel, including being in the same household as someone who has returned from overseas, or they are the close contact of an existing confirmed case, or they are part of a known cluster of other cases. At the moment, we are investigating several possible clusters. As yesterday, there is the Marist College in Auckland and the World Hereford Conference that was in Queenstown earlier this month. There is also a number of people who were at a wedding in Wellington recently, a group of people who were part of a trip to the United States. There is also a group that appear to be associated with contact from someone who was on the Ruby Princess, and that cruise ship, and that group is in Hawke's Bay, and there will be messaging out from the District Health Board around that, the local public health unit, about people who may have been in places where they may have been exposed to that person. So we want to identify them and ensure they are taking appropriate measures, and also a rest home in Hamilton. I don't have any further details about those clusters, but we will be providing information on them on our website. So in summary, the combined total of confirmed and probable cases in New Zealand today is 283. On the topic of personal protective equipment, it's important that our health workers and also people working in essential services, at least some of them, are able to access PPE. So we have a number of measures in place to ensure that PPE equipment is available for those people. It is already available for a range of health workers, and we have a separate stream of work to ensure there is a supply to essential workers, for example, staff in supermarkets, and that supply is continuous for the period that we are in the current arrangements. An example for the DHBs, we're releasing 600 masks later today to District Health Boards from our pandemic stock. We know that we have good production of masks onshore at a rate of more than 200,000 to be produced each day, so we are making sure that there is a steady flow of that equipment, both masks and other PPE, to our District Health Boards. I also want to just announce on behalf of Pharmac a change to the pharmaceutical schedule effective from 11:59 p.m. this evening. And this relates to ensuring that all people can access the pharmaceuticals that they need over the coming month. We have seen some stockpiling, unfortunately, by people. There is no problem with the supply chain at the moment, but we do not want to get into a position where some people are unable to get the pharmaceuticals they need because others have them stockpiled at home. So, from later tonight, pharmacists will be required to limit dispensing of all funded pharmaceuticals to 1 month's supply or 3 months' supply for oral contraceptives. Pharmacists may use their discretion in implementing this more immediately today. There is no change to the way prescriptions will be written, and people won't need to visit their prescriber more frequently. It is simply a change to the amount that is dispensed at each visit to the pharmacy. And this is indeed to manage medicine stocks and ensure our supply chains are robust. There is no significant shortage in any area at the moment. Once again, as with the current arrangements that Pharmac announced a few weeks ago, pharmacists will still be able to make exceptions on a case-by-case basis. For example, where people live remotely and it's harder for them to access the pharmacy, or where they have mobility issues, so it's a challenge for them to get out. And many pharmacies are now in the process of, if they haven't already, organising home delivery of pharmaceuticals. So my final message before I hand over to Mike Bush to update you on some matters is just to reiterate some key messages. These are unprecedented times for both this country and indeed people around the globe. We are all in this together, and we will expect the number of COVID-19 cases in New Zealand to continue to increase over coming days and for at least 10 days. If we all do our bit and help to break the chain of transmission, that number will start to decline and we will be able to get on top of this. So I just urge all New Zealanders to continue to do their bit and, of course, as ever, look after yourself and look after your friends, your family and your community.
3 things I'd like to cover off today. The first one is in relation to the milestone event at the High Court this morning in Christchurch. I want to acknowledge the courage but also the grief of the victims. And I have no doubt this plea will have an impact on all of you, and it will ensure that you don't have to relive this through a court trial. I'd also like to make mention of the very large prosecution team and all those involved in getting this to this particular point. I can't talk any more about this, obviously, because the next milestone event will be a sentencing matter. So I'll leave that there. If there are questions later, I'll do my best to answer them, but really I'll be very limited in what I can say. Secondly, what I want to talk about is this is day 1 of how we go about responding to level 4 of the COVID-19 response. What we're seeing out there today is no surprise to you. You've already reported on it. The majority of New Zealanders are already ahead of that compliance. They're doing a great job. Our job is to ensure that New Zealand and New Zealanders are safe, that they're well, and that we ensure that our country is sustainable. So let's just think about that most high-level principle. Stay home to stay safe. Respect others. If we don't comply, the consequence of that is that people will die. Our job is to ensure that we keep those people safe and well. How we're approaching this is by being very visible out there in the community. Our approach is that initially we're all about engagement, we're all about encouragement, and we're all about education. What we'll do next is engage with people to ensure that they know what's required of them. We'll take a discretionary approach in the first instance. People will be warned, people will be challenged about whether or not they're an essential service or they're going about essential things. But we will ensure that people will need to comply. And I'm happy to talk about how that might look. But I know that people everywhere across New Zealand are very, very keen for their friends and for everyone else to do their best to keep each other safe. And we'll do everything we can to ensure that happens. The third thing I'd like to talk about is how we're greeting and welcoming and looking after people returning to New Zealand. In very quick time, we set up a process at Auckland Airport first, but any other international airport, to manage those people in this new environment. Everyone who arrives in the country from the early hours of this morning have been greeted by customs officials, by immigration officials, by other officials, including police, and then triaged. The process works like this. If you have any symptoms, you will be then taken by health people to a place of quarantine. We have a number of hotel locations proximate to Auckland Airport. You will be taken there. Everyone that lands here will also be taken to nearby locations and triaged there. If you have a plan, if you have a place to go, we will help you get there. If you have friends coming to pick you up, only one person in your bubble will be allowed to pick you up and take you to that place. Otherwise, we'll facilitate it for you. Because it is, again, ensuring that we keep everyone else safe. We've had 360 people through Auckland Airport this morning. That process has been managed well. A few speed bumps, as you'd anticipate, but we'll do everything we can to be compassionate and caring to all of those people. But again, making sure that we all comply with that process.